This is cardiac catheterization. A cardiac catheterization can be done to all ages, it just depends if it is needed. It can be done to find disease of the heart muscle, valves, or coronary arteries. Cardiac catheterizations are done to correct an already known problem in the heart or to find another problem in the heart. It can also be done as part of a procedure to treat heart disease. Cardiac catheterizations are performed by a specially trained cardiovascular invasive physician and their team. They are performed in a cardiac catheterization lab. Heart caths are done if an ECG or stress test suggests that there may be a heart condition. It may also be needed to evaluate blood flow to the heart after a heart attack, coronary artery bypass, or coronary angioplasty. The catheterization is done by inserting a thin tube called a catheter into an artery or vein in the groin, neck, or arm and threaded into the heart. Dye called contrast is injected to see if there is blockage. Patients are usually awake but given a relaxer. Some of the equipment used is a catheter, scalpel, needle, syringe, X-ray machine, contrast, and guide wires. The patient should not eat or drink 6 to 8 hours before the procedure. The patient also should not take medications unless okayed by their doctor. They should arrange for someone to take them home following the procedure. No other precautions are recommended to be taken. The associated risks are puncture site bruising, stomach sickness, allergic reactions, bleeding, heart attack, stroke, damage to the artery, and infection. The outcome is different depending on the catheterization is being done. The patient's doctor examines the results and talks further about the steps and procedures. It is not a highly invasive procedure, so there is not much to worry about. There is little pain involved. The shot of anesthetic may cause a small sting before the numbness sets in. This procedure could save someone's life by finding the issue in their heart. Convince a family member by reminding them of the rewards. Tell them how it could give them more time to spend with their loved ones.